Hey, what's up everybody? Remi Sovran here, RemiSovran.com. I'm about to go off on a little rant in today's video, and this little rant that I'm about to go off on is something that I should have done and should have addressed in a video quite some time ago, because this is a very serious issue that is affecting thousands of people. And it's something that I have been reinforcing on my channel, it's just I haven't directly tackled or addressed it in a video, and I feel like it's come to the point where now I need to address this because it's a very major issue going on. And the issue that we're going to be talking about is why the medical model today, the way it's designed, is flawed, specifically for people with lower back pain. So, when you're someone that has lower back pain, one of the first considerations you do to kind of figure out what your issue is and to get treatment is to go see a doctor. Whether that's you go see your family doctor, you go to the clinic. Now, upon going to the clinic, they may give you a 10 to 15 minute little consultation or assessment, and then they may put you on, give you some anti-inflammatories, painkillers, maybe send you for an x-ray or something, and then maybe also refer you to physical therapy. However, the problem is that within a 10 to 15 minute consultation, that is not enough time to specifically assess somebody with lower back pain, because there are so many potential issues and causes of lower back pain that one would need a lot of time to directly assess everything from not only a kind of a motor pattern perspective, but also a physiological perspective, a biomechanical perspective, and also a psychosocial perspective, understanding the feelings that an individual may be experiencing when they have their back pain, whether it's feelings of depression, and just being able to sympathize and relate to them. And a lot of the doctors out there, or healthcare practitioners, don't really consider that, and they just kind of consider a lot of patients or just people coming into the clinic as another number, another person that they're just looking to kind of get out of the office sometimes as quick as possible without kind of sympathizing or connecting or relating to them, and then giving them a specific maybe diagnosis. So the big issue here is that a lot of these clinicians and doctors that you see, they're not specifically trained to assess lower back issues, and they're not specifically trained to assess this from a global perspective, which is something that I kind of have been recommending of how a injury, not only a back injury, should be treated, but any injury for that matter. Because number one, we need to educate the individual about their injury, teach them what movements, what activities and exercise they should be avoiding in order to prevent further problems. And then number two, we have to identify any maybe nutritional deficiencies, but also identify muscular imbalances, address imbalances that do exist, and so we can strengthen certain muscles up to help support the spine, or whatever injury it may be, whatever muscles are required to support certain joints, ligaments, whatever the case may be. So, not many people, the point that I'm trying to make here is not many people are trained specifically to assess lower back issues with a quality approach. Now, those kind of doctors that you're seeing, when they refer you to physical therapy, physical therapists they may give you corrective exercise, which would be good because they're addressing one issue, which would be the kind of the exercise kind of prescription pattern. They may be developing a program for you, teaching you what exercises you need to do, identifying postural imbalances, muscle imbalances. However, the problem is they're not trained in a sense to kind of assess or address maybe nutritional deficiencies, and they may not be specifically familiar with disc injuries, and they may not know what activities or movements you need to avoid. And also another thing, sleep's another thing. Someone may not be sleeping properly. These people aren't maybe not trained to teach individuals on how to sleep properly, but also at the same time, they're not considering the psychological or social aspects involved with the injury and what people are actually going through when they suffer significant pain. So that's kind of the physical therapist, but we could also look at pain doctors. Sometimes you'll get referred to a pain doctor, and when going to a pain doctor, they may just load you up on analgesics, pain medication, just to kind of treat the symptoms. You're not actually treating the issue there. You're just kind of treating the symptoms, which you wonder why we have such an opioid epidemic here, is because we're not actually treating or preventing the issue. We're just giving people painkillers, prescribing painkillers to help people with the pain. And then one of the worst things is when doctors tell people the pain's in their head when it's not in their head, because those doctors don't know what the actual individual is going through because they never experienced them themselves. So that's one of the worst things that I think, any doctor could say is the pains in your head. And it happens commonly to a lot of people, and I know it's happened to a lot of my subscribers here on this channel. But the point being is that a lot of these doctors out there within the medical system, they're not specifically trained to deal with all these different cases of lower back issues. Whether that's a disc bulge, whether that's some sort of arthritic condition, maybe an SI joint issue. They're not specifically trained to assess, number one, assess, but also treat and educate people about their problem. So that's why we get this huge disservice and failure occurring within the system, and it's very flawed because not only are we doing a disservice to the patient, the individual with lower back pain, but we're also doing a disservice to the doctor because now we're not getting results. But ultimately, it's the patient, the individual with the lower back pain, that's getting the worst of this because when they go to physical therapy now, they're forking out a lot of money, and the treatment may not be working because the physical therapist doesn't know how to properly address the issue and educate the individual about what they need to be avoiding. Now, I'm not saying this is every physical therapist, doctor out there. There's probably a select few that are actually good and trained with assessing lower back issues, but a high majority aren't. This is why we get a lot of problems occurring. And then lastly, we could also talk about the neurosurgeon. So, individuals, this is probably a huge issue that I think is occurring too, which is terrible, is that when people, first get their back issue or have their back pain and they go see a doctor, there's this referral process that may be occurring, but, they may refer to some sort of specialist. But in order to see that specialist, it could take maybe 6 months, 2 months, 3 months, or maybe it could take 6 months to get an MRI done. And during that period where that individual is waiting to see that specialist, they could be getting significantly worse, doing significantly more damage to their back without even knowing it because no one's educated or told them what they need to do or need to avoid in order to kind of heal their injury. And so then the next thing you know is these individuals now that their pain has got so severe and they're fed up with the process, they don't want to be in pain anymore, or the injuries become so severe that they have like neurological problems, maybe loss of bowel function, or whatever the case may be, is now that they need surgery to be done. And that is a major, major issue because as you see it's a whole process, and the whole process involved is flawed, and it's not designed to address people with lower back issues. And that's considering things from a scientific standpoint and a political standpoint, because the system fails everybody, essentially. And I'm not blaming doctors or physical therapists out there. I'm blaming the way that the system is designed because there's very few people out there that are specifically trained to address lower back issues and tackle every perspective. That being sleep, nutrition, the psychological and social factors, the exercise prescription, prescribing the proper exercises. There's very few people out there that are trained that way. And this is why we have a major problem, and this is why back pain is one of the leading causes, if not the leading cause, of medical disability in today's society. It's because the system is flawed, and the medical community and the people in charge of it all are not taking it serious, and it's doing a disservice to everybody, and it's a major issue. It's something that needs to be addressed, and it's my mission, one of my missions, to kind of address this issue and inform people about this, because I personally think it needs to be changed. We need more people out there that are lower back pain specialists, know how to we need more people that know how to specifically treat these types of injuries or treat lower back issues, because ultimately the way the system's set up is just doing a disservice to so many people, and people are ultimately they're losing money, they're in pain their whole life, their quality of life is diminishing, and people are becoming depressed, and it's not working. Things are not working, and it's terrible just the way everything is up. It's disgraceful, pretty much, to say, guys. It's very disgraceful, and there needs to be changes. So that's kind of my rant, guys, and just what I wanted to kind of address today, because it's something that has bothered me for quite some time. It affected me personally, as you guys know from hearing through my story. If you have seen that, if you've kind of listened to my story, you'll know a lot of the issues that I went through with regards to seeing doctors and just not getting better. And it really took me until I did my own research and did my own rehab that I actually got better and started making a recovery. So guys, if you guys agree with me on this kind of issue, be sure to give this video a thumbs up. And also be sure to share this video because I think a lot of people out there need to be informed about the way the medical model is set up, because it's flawed, it doesn't work, and it's doing a disservice to everybody, not just the patients, but also the doctors themselves and a lot of practitioners and clinicians out there. And there needs to be a change in the way it's set up. Okay guys, that's it for this video. I'll see you next time. Take care. All the best.